1.
Good morning. We're here again to answer questions for the community. I'm happy to say that we have not had a surge, a spike in this county. The state certainly continues to climb. Certain counties, like Fremont County, has had a major spike in cases. And that's because I think people in town are paying attention, trying to social space. I do hope people will continue to wear masks. I notice as the weather's warmed up and when I go to City Market, when the boss lady sends me shopping, that there has been a somewhat decrease in masks. I still encourage people to wear a mask. The reason we're wearing a mask is if you happen to be an asymptomatic carrier and not have no symptoms, but you have the virus, you could accidentally spread it through the environment. And this is protecting other people, actually, more than protecting you at this point in time. Dr. Chu, hello.
Hello.
So the counties, I believe, that are the hotspots in Wyoming right now are Fremont, Teton County, and Laramie County.
And so if you decide to travel there, since we can travel in the state, try to be careful even more in those areas. We do note that the governor has lifted a travel restriction from out of state, but if you go out of state, please wash your hands, wear your mask, social distancing. Do not go to a concert, please. That's or there's a recent thing where somebody went to a birthday party and said, I think I have COVID, didn't wear a mask, and 40 people got the disease, and then it spread from those 40 people.
Also important as we start going to restaurants again, be sure that you're doing good hand washing and not touching your face, because even though the restaurants are doing their best trying to keep things clean, you're still going to pick up things if you're not careful. So.
Yeah, I think it's 2 restaurants in town have opened up, is what I understand. And I've not been there, but I heard that they have appropriate social distancing and they're doing their level best to train their staff.
So as many of you know, last Friday the governor gave a little talk and opened things up to business establishments, but very restrictive guidelines as far as the distancing, even being up and around within restaurants, bars, that kind of thing. Inability for servers in restaurants to clean tables off while you're still seated at the tables or refill drinks. So please be very patient with the business owners. They're not the ones making up the rules, they're just doing their best to follow the rules, and they're mandated to do so. So keep that in mind.
And the next point is testing. We do have testing available. If you have symptoms, please contact your primary care and possibly get tested for the COVID-19.
Yeah.
We would like to be able to follow to see if, as these regulations are relaxed, whether we're able to see a surge or not. We'd like to be able to catch that early. So the more people who have symptoms that get tested, it'll give us a good idea of whether we're getting a resurgence of the disease.
But the tests that you get, the nasal swabs that you get have to be ordered by a practitioner. So you cannot just self-order these and do these. So yes, call the clinic and they do a drive-by service, do swabs with a scheduled appointment.
Yep.
I've also been asked by several business owners as far as screening of their employees coming back to work. We don't have adequate testing to test patients without symptoms, so we can't do that general screening at this point. But symptomatic patients, we do have the ability to test now. That's not the immediate point of care test. That still has to be reserved for patients that are more seriously ill, being hospitalized, or certain circumstances of being in confined or confined areas, such as nursing homes, jail, that kind of thing, where they have the inability to distance themselves appropriately.
And then I'm sure everybody is wondering about antibody testing. We have, through our company that has our machines, we are on the list now to order some antibody tests. The earliest we probably will get any antibody test is 4 weeks. Quite often longer, depending on where this company's machines are across the country. It's a very large company, so I'm sure it's in every state. And once again, the antibody testing, if you have the antibody, it shows up that you had the disease, but it does not mean you're immune to get it again or not. That's what we don't know yet. It's not that we hope you're not immune. We do hope you're immune if you have the antibody. We just don't know if it is effective against this virus.
So then it hasn't been around long enough to get that information yet. So even if the antibodies offer some immunity, we don't know if that's just transient or if it's a long-term immunity with other viruses. But not all viruses, if you have antibodies, that doesn't guarantee perpetual immunity.
Dr. Chu, you touched on the drive-by screenings that are available through the clinic setting. Can you explain that in more depth?
Yep, so what we'll do, and we're trying to figure out, kind of our process going forward too, because as you can imagine, it's a changing target. But so what we'll do for the drive-by screenings is we have people make appointments ahead of time, then they pull up in their car, somebody comes out then, wearing the appropriate protective gear, asks questions, and then does the screening. So if they feel that it's somebody who maybe needs to be seen in the clinic, like let's say if they have a really low oxygen level, might need some oxygen, things like that, then they'll bring them in. But otherwise, for like surgeries, upcoming surgeries, things like that, then if they are asymptomatic or if they're stable enough that they can be seen in their car, then we'll try to do that.
And we are opening up phase 1 for our elective surgery, which means that people that have been waiting for surgery, just like I talked about 2 weeks ago, we've got to start taking care of patients, not just COVID patients, that we are opening up to surgeries. We will carefully open up at phase 1. It'll be a 3-phase approach to try to reduce the risk to the surgery patient, other patients in the hospital, and the medical staff here at the hospital, as well as obviously everybody else that works in the hospital. But with this, we are going to have some pre-screening requirements, which means that we have to get a nasal swab, you have to not be ill, you'll be asked a lot of questions a week before, at the time you arrive for surgery, so do not be alarmed by that. We're just trying to protect you and the staff and the surrounding patients.
So everybody that has an elective surgery, there will be a requirement for the testing 1 week prior to the surgery. One other thing with opening up business establishments or the gradual reopening of establishments, unfortunately, we're not in a position to relax our visitation in the hospital at this time.
Also with graduation coming up, graduation parties and such like that you would normally have, we still discourage it. You still have that 10-person limit that applies everywhere. So you have to that number for businesses and other areas. So
Mother's Day, we had the 6-person, actually we had 7 people limit. But we actually distanced in the house when we had Mother's Day.
Okay, so we do have a question. During the last nursing panel discussion that was held with some of the different leadership from Carbon County, it was noted that only 7 cases are in the county. So why did that nursing panel say that we still have a lot of COVID-like disease within the community if the tests are coming back negative?
Because a lot of patients that we had call the clinic, go to the emergency room, we did not have adequate testing, so we got a number of patients that are in home isolation still. And so those are COVID-like diseases. And also, unfortunately, what we have to realize with this test, even if it's negative, it is not always accurate. The test positive is very accurate. A negative test, not as accurate. So even if it's negative, you still might have the disease. So in those patients, we are cautiously having those patients with significant symptoms that we think is a COVID illness to home isolate, because we just can't know at this time. Hopefully we'll get better tests.
Another thing to keep in mind as well, if we have out-of-state people that we test, people that are here working or traveling, if they test positive, they're not assigned to our numbers. We had one seriously ill gentleman from Texas, and that's not assigned to our county. That's assigned to his home in Texas.
And his 3 coworkers who also got ill that bunked with him were isolated in our county, and those numbers are assigned to, I think it was Louisiana, Oklahoma, and Texas.
And we don't test everyone in the household either. When you see the presumed positives on the state reports, it's because whoever's in the household may have the disease, and the people around them may develop the same symptoms, may not be tested. And so we just presume they're positive because they've been exposed to the positive and live in the same household.
Same thing if, say as an example with strep throat, if a family comes in and they all have the same symptoms, we test one member of the family for strep and it's positive. We don't necessarily test every symptomatic person. If the symptoms are similar, we presume that they have the same infection. So similarly with COVID.
And we examine those family members in the emergency room. And the reason we don't test everybody is because if we test 6 people, that's a lot of money.
Right, and that'd be unnecessary if every single person, all has sore throat, they all have the same physical exam, but sometimes we might test them if, well, this person thinks that it's strep throat, but really they had more body aches, looks more like flu, things like that. So yeah, we don't want to put everybody through that if we would still treat everybody and they'd have the same outcome.
Okay, so will the antibody test be accurate?
According to this particular test, according to the data, it was tested on less than 6,000 patients. It appears to be very accurate. Like all these tests, which is very difficult to comprehend, I know. Unless you do 200,000 tests, we really don't know. And so we'll be doing these tests, we'll be gathering data across the country since it's been released across the country, and hopefully somebody's tracking this. I think they're planning to, the company. And we'll see how the true accuracy pans out. But right now, it looks very good. This particular test that we will have will only test for somebody that's had symptoms longer than 7 days, and it will show you had the disease in the past. There are 2 different types of antibody tests. One that says you have it, and one test that says you had it. The test that is available to us is that you had it.
Okay, so how long does it take to get the results of the tests if you have gone through that process?
The antibody test? Mm-hmm. I think the test takes about 30 to 40 minutes total to collect and everything else. Because you got to do a blood draw, you got to spin it down, put it in the machine does its thing, and up pops the test.
And then your results might not be called back until later that day or the next day.
Yeah. And we plan to, if we get the test, the initial plan, subject to change of course, is that we're going to try to schedule people for Tuesday, Wednesday, Thursday, get the test drawn. Because once we open this kit, we can do 200 tests with the one kit. After that kit is used for 72 hours, we have to throw it away. And kits, the machine costs X amount. I assure you, the companies that sell these kits that own the machine, the kits are more expensive than the machine. It's sort of like when you buy something like a computer or something.
And beware of home tests on the
Yeah.
internet. I mean, if you're on Facebook or somewhere, you'll see advertisements. We don't know if they've been approved by the FDA. We don't know if they're accurate, and so you might want to hold off. And even then, if you're positive on that, we aren't sure it's going to provide protection like we discussed. So it may not be worth your money.
Yeah. And
There's even saliva tests that are being developed, but, we don't have any information of the accuracy of that.
And they have not been released, as I saw an article this morning before I came in here. I read that, check up on that. They have not, the real FDA type test that would be approved had not been released yet. If you want to buy something that's on the internet, that's a saliva test, it is probably not even real, potentially.
Do we currently have any COVID patients hospitalized at MHCC?
No, I don't think so. There's a hospitalist.
No.
All right. Will this antibody test show specific to COVID-19, not just all coronaviruses in general?
Correct. Good question. It is very specific for COVID-19.
Okay, so with that then, what is the difference between COVID-19 versus coronavirus?
All viruses, rhinoviruses, adenoviruses, if you have lots of subtypes, okay? We have 4 doctors here. We're all different subtypes, okay? And we're all a little different, internally and externally. And that's what viruses are. They all look the same, coronaviruses, generally, if you look at the pictures of them. But the specific protein structure, the RNA inside that virus, is different. And that's the reason the common cold amongst kids is a lot of times coronavirus, but fortunately not aggressive like this virus is. This virus mutated, became aggressive when it jumped to humans. And here we are.
So it's similar to, but I don't want to equate this or have somebody misunderstand, but say with influenza, there's many different strains of influenza, and every year the CDC tries to identify the strains that are anticipated to be problematic in a given season and develop a vaccine for those strains. So that's why you can't get influenza shot once and expect that that's going to carry over from season to season. It changes yearly.
There have been some dangerous coronaviruses in the past. I mean, MERS, the Mediterranean one, and SARS were both a coronavirus. So it's not uncommon.
Fortunately, those did become a pandemic.
They were very hard to transmit as opposed to the current one, which is easily transmissible.
So I keep hearing that coronavirus will be endemic. Can you explain what that means?
It'd be similar to the flu. We have the flu that comes around in waves. There's a concern that this may end up being a yearly problem, but we don't know, and we'll wait and see.
And then, of course, that leads to vaccine. We are hoping that they will develop a vaccine in 18 months. That seems like a long time, but the chickenpox vaccine took 20 years to develop. This is what it is. We have better technology to attack chromosomes and look at RNA and DNA. That's why we're being able to do this potentially faster. But that's the earliest we may get a vaccine. And then even if we develop a vaccine, it'll take another year to 18 months, when you say, to really know how effective it is, unfortunately. That's what we're looking at. But the other real problem is, as practicing physician for 41 years almost, I've noticed the flu vaccine hasn't always gotten. I remember one year when they didn't have enough flu vaccine in the country, and suddenly people were lining up at the door of the hospital demanding flu vaccine. And then 2 years later, the numbers of vaccinated people dropped again. If we get this vaccine, we have to have, since this is such an aggressive virus compared to influenza, we're going to have 95% of the population immune to stop it from spreading like this again, which means 90% of the people all out there are going to need to get this vaccine. Children, everybody. Because children tend to be potentially the carriers to spread it through the adults, because they're asymptomatic. And if we don't do this, we have failed our society.
And keep in mind, there are some people who actually can't get a vaccine who are like allergic, so that means of the people who can get vaccines, it's an even higher percentage, you know, so just needing to keep that in mind that, you know, you can't really be like, oh, well, I'm one of the 20 who's not getting it, because there's people who actually can't. So really, of people who are eligible to get vaccines, it's probably like 97-98%.
You're the public health officer in another county. Would you agree with that statement?
I agree, and even on the influenza vaccine, you know, if it's 60% effective, we consider that effective. So it's not like if you get the flu vaccine, you cannot get the flu. You can still. It just decreases it by a lot if you get the vaccination. So I suspect that'll be the same for the coronavirus if we get a good vaccine. Also, they're trying to make it one that's not a live virus, not a human live virus. They're trying to do it to stop the antibodies, and so that takes a little longer. They're not, as far as I know, they're not pursuing a live virus version of this.
I've not seen anything.
So similarly with influenza, some people kind of carry on, well, it's a myth that you can get the flu or influenza from the vaccine. And that's not possible because it's not a live virus. Now you can certainly feel bad for a day or two after getting it from it stimulating your immune system, but that's different than saying that you get the flu every time you get a vaccine.
And in fact, if you have those symptoms, your immune system is responding better than the person that has no symptoms with the flu vaccine.
Right, because when you get a flu, when you get a fever, when you get a sore throat, that's not actually the bacteria or the virus. That's your body fighting off the virus or the bacteria and killing off, you know, throat cells to try to get rid of it. So when you get sick, most of the time it's your body fighting off the infection. So when you get those symptoms, like Dr. Abels was saying, it means that you're making a really good immune response to that vaccine and that you're going to be a lot less likely to get it.
And then with the flu vaccine, even if you would contract influenza and had the flu vaccine, it tends to be much less severe and drops hospitalizations rates markedly. So all these vaccines, we're looking at reducing death rates.
Another reason that we're worried about maybe you won't get the immunity you would like after having the disease is sometimes a lot of your reaction from your body is done by T cells. It's really not done by antibodies, and so we really can't predict that. And so that's why we may not be getting immunity from these antibodies.
So what is the difference between a live virus vaccine and dead virus vaccine?
So the dead virus vaccine, they take different components of it, and it usually through a shot, although there are some live shots, like MMR, and I think yellow fever is one that's live.
I can't remember.
But
I
there's
don't give it very often.
So there's a few that are live, and so of the dead ones, they take the different virus parts, and so like different proteins, capsules, things like that, and that's what then your body's exposed to and makes antibodies to. The live one, they take a markedly weakened virus and then expose the body to it through the same process. So that live vaccine, it is possible to get the actual disease from. However, it's very unlikely. So usually it's only in patients who are immunocompromised, so going through like chemotherapy, somebody who has a very weakened immune system, so very young children, very elderly adults, populations like that. And so that's why generally we try to, if somebody we know is very immunocompromised, we try to not give them live vaccine unless it's the only option. So for instance, in Western Africa for polio, we do the oral polio just because it's a lot cheaper to get that. And so you can give it to a lot more people, even though, in America, we wouldn't do the same thing for immunocompromised, but it's based off of your resources and what you have available.
Except if you're older, that's what I got, is live oral vaccine. For polio. On a sugar cube.
On a sugar cube.
Yeah.
That's true. Depending on your age, not that anyone here is more mature than anyone else, but that there's a certain time frame where it used to be oral, and then we've changed it to, the not live polio anymore.
Apparently I'm old. Okay.
More mature.
Vintage.
Mature.
What is contact tracing? Does the hospital do it, and does public health do it?
That's a public health
Yeah,
responsibility.
public health does that. So everyone they've been exposed to, they actually track back to see where they've been and who they've been exposed to.
They try to.
So,
But the problem is this country has limited resources, the entire country. Would you agree with that?
yeah, we do good in Wyoming because our cases of the load has been low.
Yeah.
So they do very thorough contact tracing.
But that is
Some-
public health.
Yeah, and some hotspots where they've traced it back to like nail salons and such. Just having somebody that tests positive and then investigating where they've been, who they've been in contact with, and trying to find a common focal point.
And then that's what, when we didn't have enough testing, the public health would recommend isolation for the surrounding people that had contact to reduce the spread. And then public health also can get more testing now to try to do contact flow, I believe, is what
We
they're
do.
trying to do.
Yeah, we have, and like we said earlier, there's lots of testing available now. I mean, not lots, we can't
No,
test you for
not
all
lots.
symptoms, but there is, compared to where we were, if you were ill, you can get tested.
We had 40 tests to begin with total in the whole the county for a long time.
So why is this important in stopping clusters?
Okay, let's go to a pool table. You got a pool table. The balls are in the rack, you're up in the rack. One person hits that, it spreads out through the table, and all those people have the virus, and then it spreads out from there to all the pool tables in the room.
And the biggest thing is that, you know, they're so contagious before they even realize they've even been exposed. So normally if it's another disease that, you know, it's really within right when you get sick is when you're contagious, we're not as worried because you have to have symptoms and then people are going to know they have symptoms. However, in this case, somebody might have been exposed 2 weeks ago and then started developing the virus, become contagious, but have no idea because they have no symptoms, still going out, interacting with people. So that's why it's really important to prevent the spread.
It's very common to be symptomatic for 48 hours to 5 days, very common.
Mm-hmm.
And that's the problem,
Right.
like chickenpox used to be.
Has the hospital been able to get enough PPE, or is that still a shortage?
Some things we're short of still, unfortunately. We have, I think, adequate cloth masks, courtesy of the community. Thank you again. And we have now adequate material to open up elective surgery safely with enough PPE. We're still having to use our N95 masks for a protracted period because we cannot get enough. Back in the days before the coronavirus, when we would go to a room that somebody had a serious contagious illness, we put the mask on, we'd take the mask off and throw it away. We cannot do that anymore. Things like that. We're still short gowns, but we've gotten a donation of some Gore-Tex gowns from some people, and that has helped us protect our ambulance crews in Carbon County, both in Saratoga and swims. Is what I'm talking about, as well as the ambulance crews here. We have enough of these Gore-Tex gowns for the ER staff and up on the floor now, fortunately, for when we have somebody that's COVID, which we thank you for. So that's helped our gowns considerably, because this gown is completely washable. Gore-Tex should last forever almost.
As far as the N95s, even though we use them for multiple patients, either we have another cloth mask over the top of it or we have a face shield. So it's not like it's being directly exposed to the patient. So that keeps us sterile.
And we've learned how to take the mask off compared to what we used to do, so that we safely store that mask. And if we store that mask in a paper bag, the virus will be dead in 24 hours. And not only that, when the people put their mask on, they put it on, never touch the outside of the mask, and they put it on washing their hands 5 times while you put this stuff on, so that we will not spread it to you.
Do you anticipate that the illness and death rate will increase with travel now that the country is starting to open back up?
Oh, yes.
Yes,
Yeah.
but
Absolutely.
But the real question that people have, that this is a difficult thing, because if we remained locked down in 18 months, what would happen to our society? I don't think any country can survive total lockdown. Even though if you talk to the infectious disease doctor up in Casper, he obviously advocates lockdown because that's what we should do to stop this. But I just don't think it's possible. Because if we lock down, that means trucks won't run and the grocery stores will be empty in a few days.
But I think an important thing to keep in mind is that with opening things up, not to interpret that all of the risk is gone. That hopefully people have gotten used to wearing masks, and that's going to be with us for a long period of time. And even if you're not concerned about yourself, doing your part for the rest of the community is very important.
So will the hospital and clinics continue with the screening stations and processes that have been implemented? Is that going away anytime soon?
The COVID committee met, I believe it was yesterday, wasn't it? And we are going to continue our screening because once again, the disease is still out there. And we've kept it out of the hospital so far. We've had no cases within the hospital, so we're going to keep our guard up because we have to. I will tell you, none of us like doing this to anybody. It's like prison or something, but it's necessary at this point in time because the disease is still out there.
And one of the clinic processes that we're doing with splitting our two clinics, so that's we're only able to do that as long as what's currently in place is called a 1135 waiver, and that's why we're able to do that. So if the president pulls that waiver, then we have to have everybody back at FPC, but we are taking safeguards. We're coming up with a plan of how to do that as safe as possible to minimize exposure. So just know that things may look different. So it might be now, instead of people sitting in a waiting room, you're waiting in your cars, you're waiting outside, if it's somebody who walked to the clinic, things like that, that there might be a few people who are allowed in who don't have vehicles to sit in the waiting room, but everybody else will probably be screened by the car. We probably are going to have a phone number that people call when they arrive to the clinic to start the check-in process to minimize any contact with other people. You will be asked to bring, your own pens, things like that, and then that way it's something that, as much as we can, we limit exposure to our staff and also our patients from other patients as well.
Even though it can be an aggravation to patients and family members, all hospital employees as well are screened twice a day for fever and symptoms.
Is the disease mutating? I've seen that they are now linking children's illness and death to Kawasaki disease, or is it simply that we are learning more? Can you speak more to that?
Yes. The viruses mutate. All viruses mutate. This virus is mutated also. The strain on the East Coast is different from the West Coast, apparently. But the side effects of this particular virus have been unexpected. It's acting different than most coronaviruses. This side effect of possible Kawasaki's disease, the rashes, the changes to circulation in toes, particularly in children, and now this new polyorgan disease is due to a specific problem with this virus. This virus is so inflammatory, it inflames multiple systems, particularly all the lining of all your blood vessels, and causes these clots, causes all these problems, and this is what you're seeing with this Kawasaki disease-like illness. Would you agree with that?
Because Kawasaki disease is an inflammatory response. It's not the actual virus itself doing it.
So will that mutation hinder the trying to locate or create a vaccine? Is that?
There's common antibodies that now. It won't affect the antibody testing because it's on both strains. Well, I know of the two strains.
Yeah.
And so there's plenty of common elements.
What they're doing with any vaccine, and this vaccine, there is a specific spike protein on this coronavirus that apparently does not mutate. And they're going to try to focus on that so they can attack that specific protein, because that specific protein is a little spike on the virus that allows it to get in. That's what they're working on. Does that make any sense out there? If not, I'll try again.
Okay, the only other question that we have at this time is how will we be able to test large groups such as colleges for coronavirus, as looking ahead to fall, as even elementary school, colleges, as those types of organizations look at reopening?
We're not planning on doing mass testing like that.
Yeah, it would depend on the Wyoming State Public Health to get enough testing units, and then, more importantly, getting enough people to run the tests.
Right.
That's the state end level, because as you know, public health is state to state. The federal government actually does not control public health by law. So write your governor.
Okay, is there anything else that the panel would like to add today?
Just reiterate, we want people to get tested.
Yep. Please.
When we didn't have the test, everybody wanted testing. Now that we have the test, really not that many people want testing. So we want people to get tested if they have symptoms.
And our supply of tests are currently good, but if we get a surge of testing, we may have to slow down again, so be patient with us. We can only get so many tests. We're only allowed so many tests per hospital from the state health department, and they decide where they go and how they go. It goes to each public health county, people to disperse to the hospital, state, county, to the hospital.
Which is why we can't screen people if they're not symptomatic.
Yep. Still not enough.
So if an individual does want to be tested, particularly here in Carbon County, what is the best way for them to do that? Do they still need to call the hotline that MHCC created initially, or how should they go about that?
Yep, so ideally it'd be best to call the clinic, and then we would have one of our providers do a phone triage to see if it's something that you would meet criteria to either have a car screening or come into the clinic to be screened. So that would probably be the best pathway. And keep in mind, this is only for symptomatic patients. Anybody who is pre-symptomatic, so doesn't have symptoms yet, we unfortunately don't have enough tests to be able to test people. And one thing to just kind of loosely related to the clinic is we do have a new physician starting June 22nd, Dr. Mike Sell. He is raised here in Rollins. His family still is here and also in Laramie. So we're very excited to welcome him into our clinic and back to our community. He's been away for too long.
So I did see on the hospital's website and Facebook page that appointments are required for lab and radiology. Why has that been implemented?
That was implemented because we want to make sure we can maintain social distancing when people go through the screening process, escorted through the hospital by staff, so we don't have clusters of people. We want to protect the cluster effect of 10 more people standing together with unknown state of disease. And we also did this because we have a specific area for nursing home patients only. And we are very careful. Nobody goes through that area except nursing home patients, because if we get a surge in the nursing home, death rates will skyrocket. Janessa and the people over at the nursing home have done an excellent job of preventing any disease there, and we support that. So this is why this inconvenience has been forced upon you guys. And that's the only reason. And believe me, when we start the elective surgery, we're already trying to figure out how to make the process more smooth early in the morning, because we know there's going to be a little difficulty there too. So sorry about that.
All right, so I think with that, we're going to be able to wrap up a little bit early today. Thank you everyone for joining us. Again, Dr. Stephanie Chu, Dwayne Abels, Edward Zimmerman, and Dr. Greg Johnson are our panel speakers today. And if you have any other questions from the public that you would like to submit, feel free to do that, and we will do our best to get back to you with those answers. Thank you, and be watching for our next Facebook Live event.
Thank you. Thank you.